Welcome into this Friday edition of the DMV Zone. Thank you so much for joining us. It's, of course, a busy day. We're going to get to everything. Let's just jump right in. Bad air quality alert as Canadian wildfire smoke blankets our region, triggering air quality alerts and health warnings. Let's take a live look outside. This is in Reston Station right now. You see that haze just hanging over us, and you can feel it as you step outside. Caitlin, we've been dealing with high temperatures, high heat for the last few days, keeping everybody inside, and now this code purple. And we haven't seen this for a couple of years, but man, it is here.
I know, and it was late last night, Homa, as a front came down from the north. They dragged all that smoke overhead. So a lot of people woke up this morning saying, whoa, this is so much worse than yesterday. And in fact, it is, because we have the thickest part of the plume sitting right over us. It'll get better by tomorrow, though.
Okay, so there is some relief in sight.
Absolutely, yes. This is the worst of it for sure on our Friday. By the way, the air quality oscillates by the hour, and right now it's showing a lot of yellows and oranges around the metro. I would still use caution and treat it as if we're in a code red or code purple, but each county kind of has a different reading on it at different times. It certainly has lifted a bit since we started the day, but if you can still smell it and you can still see it, it's dangerous air quality. So at least a code red being picked up by our maps, code purple off to the north. This could change. Again, I would just treat it as being unhealthy for anyone to be outside for too long. I mean, it can easily start to bring on symptoms, coughing and sneezing and dry eyes and mouth, that sort of thing. So here is our surface smoke forecast. The worst of the plume is over the D.C. area. That continues through tonight, but watch how it lifts northward off to the north and east by 9 a.m. tomorrow morning. That's because our frontal system is entering the picture. Winds are out of the west. It's going to push out all that smoke. It is going to bring showers and thunderstorms, but first it'll scour out the last of all of our haze. So the good news is we get rid of that over the weekend, and that'll continue into Sunday. Sunday looks to be a pretty decent day, but live look out at our Reston camera, and you can definitely see the depth of the haze hanging over the highway and the treetops, and visibility is quite poor just about everywhere. You almost have to treat it as fog and drive carefully with that reduced visibility because you just can't see as much. Right now at the airport, 3-mile visibility. This morning it was down to a mile, so we have come up slightly. 91 degrees, and the heat has really taken a back seat to being the big weather story today. Upper 80s in most of the area. I mean, temperatures are not nearly as hot because that smoke is so thick we can't heat up as much, but it still feels very uncomfortable with a hot day, with a humid day. The heat index is not an issue. It's really just all about the air quality. So looking at the current visibilities, it is worse in other pockets. Down by Quantico, down to 1.25 miles, up in Baltimore, 2.5. So if you're heading out this evening, if you're driving to the beach, if vacation begins for you today, hazards out there. In fact, satellite and radar, this does not show water vapor smoke, but it does show the plume kind of right over us, moving from western Pennsylvania through northern Maryland, D.C., and over to the eastern shore and the beaches. So all of our beach communities dealing with that thick smoke, too. It's not a pretty one out there, and it is very hard to enjoy being outside in any form. There's our frontal system west of the mountains, so that is going to thankfully come in tomorrow and kick out that smoke, but we also have to watch for those showers and storms. Could we get something this evening? It would be very isolated, would also be late. This is at 1:30 in the morning. You see a passing shower or storm, but the better energy is for tomorrow. So Saturday, you'll still wake up and it's going to look dismal outside with some lingering haze, possibly even smoke you can smell, but it should quickly move out as these storms start to fire. Here's at 2, 3 o'clock. We've got a line of severe thunderstorms overhead. We could also do a second round of showers and storms later on in the evening. The more rain, the better. But the problem with tomorrow is with the rain comes the threat for strong to severe thunderstorms. And Storm Prediction Center has now elevated our risk for tomorrow. Where you see that brown color, that's enhanced, and that's the D.C. metro and points north and east. So if you live there, best chance that you could see these slow-moving heavy thunderstorms that produce damaging straight-line winds, even a tornado risk. that's back in the forecast for tomorrow. So Saturday looks to be a busy day. We're going to transition away from the smoke, but then we're talking about severe thunderstorms. So just be very weather aware for whatever you have planned. 92 tomorrow, 88 on Sunday. Thankfully, does look like Sunday will clear quickly and turn into a really nice afternoon. At the beaches, again, storms tomorrow. You want to be ready to get off the water, but a beautiful Sunday and Monday, sunshine and mid-80s along the Chesapeake. A similar situation out at Bethany, Dewey, Rehoboth, and Ocean City. Storms tomorrow. They might come in a little bit later in Ocean City, and then we clear on Sunday and back to some really nice looking weather on Monday and Tuesday. Hopefully we get the same back home here, but as you know, it's always a little bit hotter. Either way, humidity drops Sunday into Monday. Monday looks nice before we heat up again. Tuesday, Wednesday could have some possible thunderstorms. Can't really say for sure whether that haze is going to be back next week, Homa. It's really a hard thing to predict, but it is possible. So long as those fires are burning out in Ontario, the smoke is somewhere. It's just, are we going to be downstream of it or not?
At some point, we'll be able to get back outside and enjoy summer, Caitlin.
I mean, it's been quite the summer already.
Yes, it has, but it looks like there might be some relief in sight.
Yeah,
so thank you.
Sure.
All right, as we continue to talk about the DMV being under this air quality advisory, let's go back outside, take a look. And our live pictures across the DMV, Reston Station, the Wharf, Gaithersburg, and that bottom right, I can't even tell what we're looking at there. The sky is so thick and hazy. So let's bring in our panel of experts, Associate Professor of Practice Science and Health Outcomes at UMD, Zafar Zafari, who has studied the previous Canadian wildfires that swept the DMV back in 2023, and pulmonologist and critical care specialist with MedStar Health, Dr. Brian Caneo. Zafar, I want to start with you. This happened 3 years ago, like it had never happened before. Here we are dealing with it again. Walk us through kind of atmospherically why this is happening. We seem so far removed from Canada, and yet here we are.
Yeah, thanks for having me. I guess these, based on the literature, the intensity and frequency of these wildfires are on the rise, and every decade we see an increase in them. And so the migrating smoke plumes of these wildfires come all the way down. Back in 2023, more than 2,100 miles from northern part of Canada all the way to East Coast. And so we are impacted by them.
And we've seen the images coming out of Detroit, which is ranking with the worst air quality in the entire world right now. But the D.C. region ranking number 3. So Dr. Caneo, walk us through kind of the health impacts. I know just anecdotally, when I step outside, my throat is itchy, my eyes are burning, and you can taste it, you can smell it, you can really feel it all around you.
Yes, thanks for having me on. I would say that it is very smoky out there. It's probably not healthy for any of us to be out there in this, but particularly our patients or people with lung disease, asthma, emphysema, other lung diseases have to be very careful. And all of us should avoid doing arduous things like running or bicycling outside, and if you can stay inside where it's air conditioned or you have an air purifier, that's a lot better. Wearing a mask can help with some particulate matter if you have to be outside, like you have to work outside. And I think the other thing we have to think about is small children have to be very careful about being outside. They can't tell us when their eyes are itchy or where they're feeling their chest is tight. And likewise, our pets, we have to be careful. It's very hot out there, and we have to be very cautious about leaving our pets outside. But yeah, it's pretty risky conditions for all of us, but particularly for those of us with lung disease.
Yeah, absolutely. And Zafar, are we going to be seeing this again and again? You said, the wildfire risks have risen. And again, this is coming down from Canada. So those bordering states where you're seeing it in Detroit and Chicago, but also here, should we be expecting this to happen every summer?
Well, that's a good question. I mean, based on the data we have, in our study we did some projections based on historical data from the past, and we had some scenario analysis for how many unexpected wildfires we would see in the next 10 years or so. But But I would say, yes, we should definitely expect them based on the past, the decadal trends. Like every decade, we have seen increases in both the frequency and the intensity of these wildfires.
So as Dr. Caneo was saying, we do need to start taking those precautions and taking it very seriously. Doctor, I have seen some studies and some reporting out there saying this exposure is similar to smoking a pack of cigarettes. How bad is it for your lungs? Really, I mean, is this like I'm out there smoking if I'm out there for 5 minutes, or are we talking 5 hours?
It's hard to say. It's based on the individual conditions you're exposed to. But I would say, yeah, any kind of smoke is as bad as cigarette smoke and is associated with the risk of lung cancer, emphysema, COPD. So, and if someone has something like asthma or reactive airways disease, they can certainly, a shorter exposure they could be more prone to getting sick. So I think anyone with asthma or reactive airway disease should have the rescue inhaler with them and have it handy and ready to use.
And it seems like, doctor, that it is honestly like permeating even inside buildings, inside homes. When you're driving, unless you have the recirculate on in your car, you're tasting it at that point too. So, I mean, how much more can we do? You mentioned air purifiers.
Yes, air purifiers might help. Having your air conditioner on, having the recirculation in the cabin of the car on is probably better. But yeah, I'm in a hospital right now, and I can smell the smoke seeping in just slightly. And certainly when I go outside, I can really smell it. But yeah, you can't really escape it right now.
Yeah, and Zafar, before I let you go, any last thoughts on how we protect ourselves against this? Again, this is what everybody is talking about because we are all seeing it and feeling it today. And hopefully it dissipates some by tomorrow. But as Caitlin mentioned, could potentially be back next week.
Yeah, sure. I completely agree with what has been said. And I think we showed in our study that the additional costs of only 6 hotspot days in June of 2023, where when we had similar types of migrating smoke plume, was almost $2.4 million across our hospital system. University of Maryland Medical System, 12 hospital, and so that's a significant amount of money. But obviously, that's both including direct medical expenditures as well as productivity losses and societal measures of productivity. But we basically showed in our study that if we are more proactive and hospitals are more proactive, let's say if we have automated systems that can identify high-risk patient populations and provide them with instructions and preventive measures such as face masks, that could potentially reduce the burden significantly. Anywhere from 13% to 24%, we could reduce the burden if we are more proactive and, as has been said, be more health cautious, use face mask, limit our exposure to high level of PM2.5 outdoors. That itself can significantly reduce the burden, especially vulnerable patient populations.
And at this point, it is impacting everybody, especially those vulnerable populations. Gentlemen, thank you so much for your perspectives and your expertise. We appreciate it so much.
Thank you.
All right, we're going to take a quick break. DMV Zone is back right after this.